My name is Jim Meehan. I'm a medical doctor. I'm trained in ophthalmology, and my specialty was ocular inflammation and immunology, infectious disease. I'm a medical editor of a journal of the ocular immunology and inflammation. So I have a deep background in that area. I'm also trained in preventive medicine, addiction medicine, and endocrinology. So I have a broad range of applicability in this discussion of all things COVID-19.
I'm Dr. Aaron Lewis, and I'm a pastor as well as a humanitarian and also a publisher, and I've been doing all three for the past 30 years. And so I've traveled to 61 countries around the world and consulted governments on health care reform as well as education reform. Also, I founded a school in the city of Hartford, Connecticut called the Scribes Institute that serves 2nd to 8th grade children. We specialize in literacy, STEM, as well as foreign languages. And so we're trying to raise up the next group of great thinkers amongst the children in our city. Also ran for mayor in 2019 for the city of Hartford, and looking forward to doing some more political adventures in the coming years.
We chose, our country, our public health experts chose the worst possible models that could have been chosen. There were multiple models out there. They took the Neil Ferguson model, the imperial model that had the most exaggerated claims. It was also a model that had no evidence that was provided to the peer review audience. There was no transparency. The software, the algorithms, none of that was provided to us. How our public health experts chose such a nefarious model, the worst one they could possibly choose, the one that had the least evidence and the least transparency, just confounds my mind.
I mean, I've said before, and under great criticism, that Dr. Fauci is tantamount to the seed of Satan, and I say that unapologetically, and the reason why is because Dr. Fauci clearly knows what he is doing. He clearly knows what his objectives are, and he clearly recognizes and understanding that there is a complete imbalance of power, because he, as a medical doctor who understands that his first job is to ensure the safety and the well-being of the people that he is serving, has become completely and totally self-serving in this entire process. He's convinced the entire American public that he cares about their greater good. He's convinced them that he wants to make sure that they are cured of the symptoms of COVID, when in fact he stands to profit and gain more from COVID than perhaps anybody in America aside from Bill Gates. And so, and that's something that you can do the research on yourself to discover his vested interests in continuing to keep this narrative going. And so it's extraordinarily disappointing that someone of his caliber, someone of his background, someone of his educational training has been pretty much coerced by the powers that be that he is subordinate to be a part of this tremendous grand scheme that is working against the greater good of the entire planet. So I'm horrified by his actions. I'm disgusted by it. It totally is anti everything that is good and patriotic.
I totally agree with my brother, who's got more degrees, more doctorates than anybody I know. 3 PhDs, 7 degrees rather. But he's absolutely right. Anthony Fauci has a long history of failure with the National Institutes of Health, the National Institute for Allergy and Infectious Disease. He's failed to create an HIV vaccine, but he is the big problem that I have with Dr. Fauci is that he is multiply conflicted in his interests. We have allowed many of our government employees to profit from relationships with the pharmaceutical industry. There was an act in the 1980s called the Bayh-Dole Act, and that act allows our government-funded research to be patented and then licensed to the pharmaceutical industry or to industries in general. And that creates a very powerful conflict of interest. Someone like Anthony Fauci, who has multiple of those patents and licenses to industry, stands to make about $150,000 a year per patent. That creates a financial bias. It creates a conflict of interest. And so when you see, Dr. Fauci disparaging cheap, safe, effective therapeutics like hydroxychloroquine, Zeke, vitamin D, azithromycin, ivermectin, and saying that our only hope are things like $3,200 courses of remdesivir or a vaccine that's coming. He's making money on those deals. He is making. He's financially conflicted. His interests are. He's no longer serving the public interest. He's serving his own interests, and right. I think that has to be removed from this equation. Someone that we have elevated to the spokesperson for public health in the world or in the country today that has these significant conflicts of interest. And I hope we will also cover the fact that he spent a lot of our taxpayer monies doing illegal research in China on gain-of-function alterations of viruses to turn them into more lethal viruses for scientific purposes or other purposes. These things need to be exposed. I'm thankful that President Donald Trump has sidelined Fauci for the most part and put Dr. Scott Atlas in place to kind of assume that role, because now we have someone that is serving the public interest, telling the truth, telling a truth that is backed by the science, not just backed by Gilead Pharmaceuticals or the vaccine manufacturers.
When you come to think about any level of hyperbole or exaggeration, it's always to create a narrative that controls the greater population. To tell the truth will then free the people. I mean, it's real simple. The truth frees us. Lies constrict and bind us. And so even from the very beginning, the truth behind the amount of deaths, just listening to Kamala Harris last evening was horrifying for me, because she kept lying and she kept saying that because of President Trump, there's 210,000 people that have died. And a few weeks ago they came out with the actual deaths on the CDC site that said 8,900 that were not related to any level of comorbidity. So 8,900 compared to 210,000, and then to take the low road and say all of these deaths are a result of his leadership. Something's very dangerously wrong with not only the ability to tell that lie, but what that lie does to the American people when they start to believe it. Those numbers have to be conflated. Why? Because the truth is just not cool enough for the average person to do anything about it. I mean, if you told me that one person died, of COVID in the past week, I'm still going to go out to eat. I'm still going to go to the movies. I'm still going to go to church. I'm still going to go to the park with my family. I'm not going to stop anything, but I have to conflate the numbers to the point that people become afraid. So that's really what's happened here, is that they have just totally, I mean, it's one of the greatest scandals I've ever seen in my life. You talk about how to get away with a scandal. This is the greatest scandal I've seen in my lifetime. This makes Watergate look like nothing, because they are telling just complete lies about how many people have died. Now that we're at a point where we see that the deaths in general have become so minimal that they can no longer sensationalize it. Now they've changed the language from deaths to now cases. So now, if Walmart has a special and 10,000 people come out, well, there were 20,000 cases at Walmart in the past 2 weeks. And so they've changed the language again to now make people think that if someone has a case that they're going to die. There again, it plays on the lack of education of the American people. And I don't say that in a disparaging way, but I'm being very honest about it, that when we think, when we use our minds to think, we can't be fooled by gullible propaganda. It doesn't make a difference how many cases there are. How many cases are there of people that get the flu? How many cases of people that catch a cold? How many cases of people that get AIDS? If we actually had that number, nobody would have sex anymore. There'd be no more babies. And I'm certain that there are some actual agendas that would love that to happen. But the issue is that cases really don't mean anything other than the fact that the media can use that to blow things totally out of proportion to cause a pandemic scare. And that's all they're trying to do. So I'm really saddened by the lies. It's not even exaggeration. It's just straight lies. I mean, it is what it is. For me to be honest and tell the truth, I got to tell the truth about their lies. They're just straight lying. And I hope and I pray that these lies come to light so that people will see the truth and start to walk free again. Because right now we're not free. We're slaves.
Boom. That was brilliant. And you know, when the truth wasn't scary enough for our public health experts, they started lying.